The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Welcome to Generations Radio, where the focus is on our seniors and their families. We are here each Saturday afternoon from 5 until 6 p.m., bringing you resourceful information with our radio team of professionals in the field of aging. Stay with us for the next 1 hour as we explore different ways to make life more exciting and meaningful for our extraordinary seniors. Right here on AM 690 The Answer. And now, here is our host and the publisher of Generations Magazine, Percy Ihara.
Welcome to Generations Radio. I am Percy Ihara, your host, here every Saturday from 5 to 6 and Sundays from 3 to 4 here on AM 690 The Answer. And as you know, our June-July issue is out and about by now. And look at it downtown. We have magazine racks on Richard Street by the post office, Alakea Street by Central Pacific Bank, Pioneer Plaza, Bank of Hawaii on Bishop Street, and a new one in front of Down to Earth on King Street. So check us out. You can also go online to generations808.com and check out the new issue, along with all our past issues. And we house and archive all our past radio shows at Generations Radio Shows. And today we have one of our business partners, Dave Heywood from United Healthcare. So welcome to the show, David.
Thank you. Pleasure to be here.
Yeah, and CEO of United Health Plans here in Hawaii. And you're talking earlier, it's been 10 years now since United Healthcare has been here.
Yeah, actually, I've been with United Healthcare for 10 years. United Healthcare has actually had a small presence in Hawaii since the early 1990s.
Oh, really?
And I joined United Healthcare in 10 years ago, 2005. And that's when we started up a Medicare Advantage program across the islands. And about 4 years later, started up a Medicaid program as well.
But the zero premiums, which is a big name topic on the Medicare side, was that started in Hawaii only, or was it always in the nationwide?
We've had, prior to that, we had zero premium Medicare Advantage programs in many states
really?
On the mainland, and brought that to Hawaii in 2005.
Yeah. And your background, I didn't realize you've been at Queens, you've been at Kapolani? So you have a big background.
Yeah, I've been working in healthcare for quite a few years. Started out with the Henry Ford Health System in Detroit, Michigan. That's where I'm from, Michigan. Moved here 25 years ago in 1990. Went to work for Queens for their health plan. Worked there during the 1990s, and then moved over to Kapolani Health. Worked there for a number of years, and then joined United about 10 years ago.
But you're more specifically in Medicare and Medicaid, is that correct?
Yeah, United Healthcare in Hawaii, most of what we have here work in is the Medicare Advantage programs, both what I call our regular Medicare Advantage programs. They're branded AARP.
Right.
We also have a Medicare Advantage program that's called a Dual Special Needs Plan, which is for low-income individuals on Medicare that have both Medicaid and Medicare. And that program we've been doing since 2009.
Wow. And but a zero premium is the one everybody's looking for. Is that correct? Pretty much.
Yeah, I think seniors, people on Medicare, when they're looking at a Medicare product, there's a lot of different options out there. The value that a health plan can bring is offering lower copays, coinsurance, and deductibles than what you might find with original Medicare, and also being able to do that, if possible, with a zero premium plan, and then including the Part D prescription program in that as well.
But a Part D, do you have to buy that, or does that come automatically?
It depends. We offer what we call a standalone Part D program for seniors. And they can purchase that and stay on original Medicare. Or United Healthcare and other health plans here as well will offer a combined, you get your, all your Medicare coverage combined with a Part D plan in a single plan.
Yeah. I know the enrollment period for that is all year long, but specifically a lot of people enroll in the October window, right?
Well, actually for Medicare, for most Medicare eligibles, and there's about 225,000 Medicare eligibles across the state.
That's a lot. That means they're over 65.
Yeah. Well, there's also people on Medicare who are younger than 65 who are disabled and
All right.
qualify for Medicare, or those individuals with end-stage renal disease, kidney failure, that also have Medicare as well.
But dealing with Medicare and Medicaid, is it really all about health care for the seniors?
Well, it's more than that. So, especially when you look at individuals, and with our program, especially the dual eligibles, low income that have both Medicaid through the state of Hawaii, the Quest Integration Program, and then Medicare. Many of those individuals have multiple chronic conditions. There's a number of them that need long-term care. So they're in nursing facilities or adult foster homes, or we're providing them with supportive services in their own home, even though they're at a nursing facility level of care. So there's very complex population. They have a lot of supportive needs that we help them access or provide to them. So it's the complexity. I'll have to say I've worked in health plans for many years, and when you look at those who have chronic disabling conditions and the supportive needs they require and need, very complex and very intense program to run.
Very costly.
Very costly. And making sure that those our members get the right care at the right time, the right way, is extremely important. And that's one aspect of running a cost-effective program, because Medicaid and Medicare are funded with state and federal tax dollars. Right. So it's all of us who are funding that, and so being good stewards of those funds is the right thing to do.
Yeah, and I think is that the reason why the big push is to get people to stay healthy? Because I know a lot of the Medicare plans, just about every Medicare plan has some form of exercise program where they can get free membership to.
Yeah, many of the Medicare plans have fitness programs, and for a lot of seniors, it's great that they can take advantage of that. We're lucky that we live in Hawaii because we've got great weather year round. So the ability to get out and about, whether it's physical exercise or going for a walk, or just getting out in some fresh air, we have that advantage over many states on the mainland.
Oh yeah, absolutely. Now, United Healthcare Foundation came out and I didn't realize you guys did the annual senior rankings report on, is that healthy aging, or who is the healthiest state? Can I say that?
Well, it's on quite a few different measures that United Health Foundation puts this report together and looks at a wide range of attributes in terms of for seniors specifically in ranked states. And I think what's important is maybe not so much the ranking, but actually what the findings are. And it's a good way for state policymakers, healthcare providers, and the community at large to take a look at that and say, that makes sense. Those are things we can improve on. Or those things, we're doing well at those things, and we need to keep doing well at those things.
So Hawaii ranked?
So we ranked number 4. We previously ranked number 2. So
when you say previously, was it last year we were number 2?
Last year, number 2.
So we went from 2 last year to this year. We dropped 2 slots?
We dropped 2 slots. But again, I don't think it's, the good news is that we're in the top. We're in the top tier, top 5. And so I think Hawaii does very well on a large number of metrics in terms of, our seniors, in terms of their health and well-being. And so we should be proud of that and what we do. And then it's looking at the things that are pointed out in the report where there, could be some improvement.
Yeah, both what I mentioned about underweight and obesity issues for the elderly. And you had mentioned earlier, number 1 was what, Vermont or?
Yeah, Vermont, New Hampshire, and Minnesota those were the top
That's
3.
Interesting. They're all cold states.
Yeah.
But But I'm glad. Well, they're smaller states, and like you said, our diversity as well. Having military coming in and out, in our diversity of ethnic backgrounds, it probably does play a role. But I mean, I was talking to somebody earlier today. He has been in Hawaii 25 years, and she said the good part about Hawaii is we have great food. The bad part about Hawaii, we have great food. and I brought poi malasadas today, going, oh, malasadas. Well, they're healthier. Miss Kim, our engineer here, poi malasadas are healthier. If I just had one before the show, but and in fact, I was talking to one of the staffers this morning before we taped that she needs to get out and exercise more, and we got to avoid all these health issues. So I'm glad to see that. Now, who do you folks partner with on your Medicare side for the fitness program? I can't remember who you guys use.
We've partnered with Silver Sneakers.
Okay,
before.
well, great. They're a great program. We've got to have them. By the way, tell them I want to have them on the show because I've heard so much about them, and I know a little bit about what they do. But in the report, it also mentions about a high percentage of hospital deaths in Hawaii. That's not a good thing. I believe we're number two. We're number 2 in the nation.
Yes, and I think the wrong conclusion from that is that there's something wrong with our hospitals, which is not the case.
Absolutely.
So that's not a reflection on the quality of care or the outcomes at our hospitals. I think that's more a reflection of the percentage of our seniors who pass away when they're in a hospital setting versus not a hospital setting. And when I saw that, I looked at that, and I've had some discussions with our chief medical officer, Dr. Fujimoto, and some others. And our view on that is that ranking, that low ranking, if you will, could be caused by a number of factors in Hawaii. I think one of it might be a cultural issue. And, part of it, too, is you look at, over the years, over the decades, as a population as a whole, we look more and more to hospitals, healthcare systems, and physicians to help us at any stage of our life, and even at the end of our life. And so I think there's that's occurring. I think on a positive note for nationally and for Hawaii as well, I think there is a trend upwards in terms of people looking at hospice care, understanding that hospice care can be done in their own home versus in a hospital or nursing facility. A lot of people are not aware about that. It's a difficult discussion, but I think it's improving in terms of the percentage of people who are having discussions about planning, end of life planning, and it's not just about end of life, but it's also about talking with your auntie, your uncle, your parents, in terms of what they want in their later years in terms of their quality of life. Not just we want to make sure you live as long as possible, but having a good discussion about what's important to you, in your later years. And that's really a key discussion that needs to happen more often in this country and in Hawaii.
Yeah, I mean, ethnic issues, not sure exactly why, but I think it's something that we've been talking about. In our February-March issue, we had an article about Dr. Volandes, who did the end-of-life options video with HMSA. And now I believe all the hospitals are going to start using those. And we're going to have them on next day he comes around back to town. He's coming sometime in the summer, so we're going to have him on a radio show. But, yeah, we've had him before, but it's really important that we have some of the best hospitals in the country. In fact, a survey done by the University of Hawaii, I would say about 6 years ago now, did a study of Japanese living in Japan versus living in Hawaii, Chinese living in Hong Kong and China versus living in Hawaii, in Filipino, Korean, living there in their respective countries versus ours. They all live longer than ours and live better than ours. And the number one reason why they live better in Hawaii, their location to hospitals. We're only 20 minutes away, wherever you live on this island. And it's something that everybody goes, that makes a lot of sense. So that may be a reason why they're closer to an emergency center. But yeah, and hospice as well. We're at a lower 25% of the country using it, but it is growing. And I think with these new videos now by Dr. Valanis and HMSA, I think it's gonna be great. But yeah, you guys do a wonderful job. But were there any other topics of interest that we need to know about with that health report?
I think some of the strengths that it pointed out for Hawaii was a low prevalence of obesity, which you put in the context. One of the challenges, the underweight issue, and a couple things. One is generally speaking, Hawaii has our overall population has a lower prevalence of obesity. We are seeing some unfortunate trend upward in our under 21-year-olds in terms of rate of obesity. But I think the report from United Health Foundation, looking at it as it does across the entire country, may not account for the ethnic mix in Hawaii. And so the BMI, the body mass index measures may skew it and distort it and show that Hawaii seniors are underweight when in fact they're really not. I think the important thing there when you look at seniors is really about diet, and the question there is are we, especially for our low-income seniors, are they, number one, getting adequate food, and are they getting correct and healthy food? And so I think that is something to take a look at. You mentioned, Vermont's in the top tier there. One of the things that Vermont was stood out for was their food program for low-income seniors, and that they've done a really a nationally recognized job in terms of doing that. And maybe that's something for Hawaii to take a look at. The other thing that we showed very strong at in terms of we have sufficient geriatricians, physicians that specialize in care for the elderly. And I think the School of Medicine has done a really good job of that. I don't know if you know Dr. Blanchette.
Yes.
She's, I think she's taught most of the geriatricians in the state, and she's done an outstanding job of that. So that's actually good news, because there is an overall, currently and growing shortage of healthcare workers in Hawaii, and physicians as well, especially on the neighbor islands. Is going to be a challenge for us.
Yeah, going forward, I know a lot of the premiums being cut, services being cut. And on a big island, they don't have an orthopedic surgeon after 6 o'clock. It's kind of a scary thought. So what can the seniors on the neighbor islands do? But they're healthier. Don't you think they're healthier on the neighbor islands? Because not as much fast food. That's the reason why I say that.
Well, I don't know that the seniors on the neighbor islands are healthier or less healthy than on Oahu. Oahu may look a little less healthy. I think in our experience, we do see families who may try and move elderly to Oahu to be closer, as you mentioned, closer to some of the specialists.
Yes.
They may be doing that. I think, the neighbor islands, whether it's seniors or the population as a whole, the challenge there is access to care. And, because take the Big Island, it's quite a drive to get to a physician or to a hospital sometimes. And the ability of the neighbor islands to have the kind of special, like the specialists that we have, at Straub or at Queens, Kuakini, and so forth, that's a challenge for those systems to maintain on their neighbor islands. So, in terms of addressing that, the healthcare delivery system, health plans, and policymakers, have been working, and there are a number of things that can be done. I think we've gone down the road of telemedicine, telehealth, but that's something that could be expanded, and that I think would very much help address access to care for seniors. In terms of being able to get seniors and others to the appropriate care on the neighbor islands, or getting them over to Oahu.
Yeah.
Or, also sometimes makes sense to get a specialist to go over to, go over to Hilo or go over to even Lanai, Molokai, and do a clinic there. Those kind of solutions, which have been going on, we're probably going to see more and more of that in the near future.
Well, in Neighbor Islands as well, a lot of the kids move away, so the lack of the caregiver or family caregiver over there, it's a huge problem. Our June, July issue coming out is on 3 stories about caregiving, and they're all baby boomers, and they're all taking care of their parents and their children. One on Oahu, Mr. Michael Yee, our certified financial planner magazine, taking care of his mother who had 2 strokes and a heart attack. Pamela Ani from the Alzheimer's Association talking about long-distance caregiving for her mother who was in, I believe, it was West Virginia. And then a rural caregiver, my classmate on Molokai. The lack of resources there. I mean, granted, the population is smaller, but just to have the facility, have somebody to care for them is just so difficult for them. But I know a lot of the healthcare plans does pay for transportation over to Oahu. Some of the plans.
Yes, I can't speak for the other health plans in terms of what their programs are, but that does occur in our programs for our talking about seniors, the ones who are dual eligible have Medicaid and Medicare. That's in their Medicaid benefit
Really?
in terms
Good.
of transportation, and that's not just. For example, if they need to come from, Kauai over to Oahu for a specialty procedure only done on Oahu, it's not just the air transportation, but it's also the ground transportation if that's necessary.
Wow.
And very often you need a companion too.
Cover that too?
We would cover that too when that's appropriate. When you think about it, if you've got somebody who is very disabled or somebody who is elderly with multiple chronic conditions, not very mobile, you can't just put them on Hawaiian Airlines and hope they arrive at the hospital here in Oahu without any trouble.
Yeah, it's so critical, but it can be a critical situation with the seniors in the neighbor islands. We're doing our big issue in August, September is actually we're going to cover all 4 islands. We're going to have the executive director from the area agencies on aging on our cover, and we're going to talk about every island, about the different programs they have out there. But United Healthcare, your foundation, the report. So this has been going on for many years now. So I've been seeing it just recently.
Yeah, the overall state rankings, not just specific to seniors, has been going on for a number of years. The specific one focusing on seniors has only been for a few years.
Oh, really?
Yeah.
Okay. And so hopefully we can tell our seniors to get healthier, exercise more, so we can move up. I think we should be the healthiest state in the country. So we'll see. But in terms of programs for Medicare, does you guys programs have some kind of monitoring or healthy counseling or some kind of a program to make people understand how to eat healthier? Or is it counseling or?
In our Medicare programs, not specifically. When you look at our program for our dual eligibles who have Medicare and Medicaid, and specific to the Medicaid program, for those individuals that have multiple chronic conditions or they're at a nursing facility level of care, we actually have across the islands, we've got 100 field-based, they're called service coordinators. And they're RNs, licensed clinical social workers, and they are out there in the field, and they're interacting face-to-face with our members, many of whom are seniors. Mm-hmm. And that's working with them and their primary care provider in terms of doing an assessment, which is primarily focused on their physical condition, but also looks at other attributes going on there. If there's any, behavioral, mental issues, any environmental challenges for them, and so forth. And doing the assessment and working with them in terms of a plan of care. And that could include, for example, making recommendations to the many community agencies and other groups out there that could provide services and support which aren't specific to healthcare, which could be related to, social programs, community programs, and other activities that they might benefit from.
Well, good. I'm glad. But 100. What do you say? What would you say? Them 100.
Service coordinators.
Service coordinators. Oh, that's great. Because I know one of the things that we try to do in the magazine is trying to get people to be proactive, and I'm always trying to get people to exercise more. I was telling my cousin the other day, you got to start exercising more. And he used to be in really great shape at 65 now, and he doesn't exercise anymore. So you got to start exercising. You got to get healthier. And one of the focuses I've seen with seniors that they don't want to get in the hospital. They don't want to go back if they've been before. So I was talking to our editor, Catherine Smith, who just came back from Minnesota, and she went there for a full physical, and I guess she knows a doctor there, and she's in good health, no medication at 60 something. But one of the things she talked about with the doctor is that we've got to exercise more, and I think getting them on your Medicare program, whether zero premium or not, is really, really important because Silver Sneakers and all these kind of programs is going to keep us out of the hospital. Yeah. We want to talk a little bit more about the Medicare plans and your zero premium. But so on the neighbor islands, though, isn't it getting a little harder for them seniors? And is there anything that they can do?
In terms of the Medicare, Medicare type health plans, yeah. So we talked about this actually earlier, and I think one of the challenges for the Medicare health plans is really the funding by the federal government for the neighbor islands. And for Hawaii, the CMS, the federal government, the island of Oahu, Honolulu County, is viewed as an urban area. And the neighbor islands are viewed as rural. And the underlying payment rate, if you will, to the Medicare health plans is very low for the neighbor islands, and we think it's set too low.
Because it's rural?
Well, because it's a little complicated. It's based on the Medicaid fee-for-service population, which in Hawaii is actually a pretty small percentage of the total Medicare eligibles, because there are, of the 225,000 or so Medicare individuals in the state, just over 100,000 are in Medicare Advantage programs. And then you've got a substantial number of military retirees that are in TRICARE for life. And then there's 30-plus thousand state retirees that have benefits from the EUTF. And then you have the federal retirees. So those who just have original Medicare fee-for-service is very small. And that's what the CMS calculates the base rates from. So as a result, the payment is very low for the rural counties, the neighbor islands. The Hawaii Association of Health Plans has been communicating through a congressional delegation, working with them to try and have CMS, the feds, take a look at that payment level. And I think that would be a good step in terms of if that could be adjusted, corrected, to be able to offer to seniors on the neighbor islands a better Medicare program.
Great information, Dave. We're here with Dave Heywood from the United Healthcare, the CEO in Hawaii here. We're going to take a short break, and we'll be right back.
We will be right back with Percy Ihara from Generations Radio. If you have any questions or want to be part of our discussion, give us a call at 296-5467. That's 296-5467. This is Generations Radio on AM 690 The Answer.
I was an addict from the age of 13. I finally decided it was time for a change. I walked into the Salvation Army Adult Rehabilitation Center, and that got me ready for the real world. Now, I choose to be guided by Jesus Christ, and today, I'm building a powerful and promising future, free from drugs and alcohol.
please shop at the Salvation Army family stores. With our discounted sales, your support through your purchase helps men live a clean, sober, and productive life.
Simplify your life by opening a My Social Security account. What's My Social Security? It's a secure, online account that allows you immediate access to your personal Social Security information. During your working years, you can use My Social Security to view your Social Security statement, to check your earnings record and see estimates of the future retirement, disability, and survivor benefits you and your family may receive. If you receive benefits, you can get a benefit verification, check your benefit and payment information, change your address and phone number, and even change your direct deposit information. Open a My Social Security account today and simplify your life. Just visit www.socialsecurity.gov/myaccount. While you're online, check out all the other things you can do at www.socialsecurity.gov.
Today, more than ever, we local people are living longer than any other state in the Union, with more seniors, baby boomers, and caregivers. Generations Radio promotes the importance to be proactive as we all age. The radio team will focus on issues facing our seniors and their families, finding resources to navigate healthy aging along with financial, legal, and caregiving information. So join Percy Ihara from 5 until 6 each Saturday, right here on AM 690 The Answer. Focusing on the issues facing our seniors and their families today. Here's our Generations Radio host, Percy Ihara.
Welcome back. I am Percy Ihara, your host here of Generations Radio. And as you know by now, the June-July issue will be out in the stands and at all our major distribution points, the Hawaii State Library on every island now, the YMCA's, Honolulu, Big City Diner, Vacations Hawaii, and as you know, on our website, generations808.com. But yeah, the library is at a big distribution point now because we're in all the libraries statewide. I believe there's 48 or 49 statewide, so that's really great. And the libraries are really becoming a great resource and a great safe haven for people to get given information. So it's a great place to go. So check that out on neighbor islands especially. But the June-July issue will be covering our 3 stories on caregiving. Michael Yeed, a certified financial planner, taking care of his mother and his children. And then we have Pamela Ani from the Alzheimer's Association talking about her long-distance caregiving of her mother in West Virginia. And then lastly, Lori Misaki from the island of Molokai talking about rural caregiving. So it's a big topic. As well, we have in our big spread there, it would be the 9th annual Aging in Place workshop listings of all the workshops. We're going to have 18 workshops in the morning and then replay them in the afternoon at the Alamana Hotel. It's Saturday. No reservations required. Just come and show up. It will be very crowded, so try and come early. Bring a box lunch or bento lunch, or we go over to the Alamana Shopping Center to get a quick bento or lunch. But plan to stay all day. We are going to feature Alzheimer's in the big room. And so we're going to have the Alzheimer's Association talking about 3 major topics. As well, we're going to celebrate during the midday break. AARP is going to celebrate Social Security, 80 years of Social Security. So we're going to serve cake during the break at 11:30. So that'll be a great thing. Hopefully, we're going to get some politicians there to talk about Social Security. But anyway, we're here with Dave Heywood from the United Healthcare Community Plans. And Dave, you brought up an interesting topic, or I guess topic of dual eligibles, and I've been hearing about this. Is that something recent? The dual eligibles?
No, that's been around for quite a while.
Oh, really?
And, you just mentioned 80 years. So what's 50 years? It's a test for you.
What do you mean?
It's been 50 years.
Medicare and Medicaid.
There you go.
Okay.
Yeah.
Oh, he caught me off guard there.
Yeah.
I heard about that just I think yesterday.
Mm-hmm.
We should do something.
Yeah, 50 years. So
Wow.
The Great Society in the 60s, launched by President Kennedy and
Yes.
implemented by President Johnson.
And I think with the baby boomer era, that was the era of the baby boomers. And I think really the baby boomers going forward are going to carry forth some of this belief of giving back to the community, saving the world, and donating money. I think Bill Gates and Berkshire Hathaway guy has been trying to lead the community, the world, and giving back to the community and donating. And it's one thing we were talking about with Salvation Army last week about kind of give back to the community. But yeah, I didn't realize dual eligible has been around for a while, because I only heard about this term recently.
Mm-hmm. No, it's been around for quite a while. And basically it refers to a person who is eligible for both Medicare,
65 and over.
65 and older, or disabled, or with end-stage renal disease, as well as having Medicaid. And so it's the combination of those two programs. And so, to qualify for Medicare, as you mentioned, the Medicare disability, or you're over 65. To qualify for Medicaid, that's basically that's based on income level. So low-income seniors, if they're in that range, they can qualify for Medicaid. So Medicare is handled by the federal government, CMS. To qualify for Medicaid, that determination is done by the state of Hawaii Department of Human Services.
Is that asset qualified as well? Because I know the income changes every year, but I mean, is it asset qualified as well? The $2,000 for a single individual.
So there used to be an asset test for all Medicaid recipients in Hawaii. That has changed recently. There still is an asset test to qualify for what's called long-term services and support. So for nursing facility services, or alternative settings like an adult foster home, or receiving services and support in your own home. That still is an asset test there.
Okay, so the dual eligible. No, that's not MedQuest, is that?
Yes,
it is MedQuest.
Yeah,
okay,
it's MedQuest.
So there's no asset test for the MedQuest.
Well, okay. So a bit of history here. The state of Hawaii DHS had two Medicaid programs. They've Quest, and that's been for the non-age blind and disabled. And that program's been in place since 1994. Yeah. And then the Quest Expanded Access Program started in 2009, and that's for the age blind and disabled.
QXA?
Yeah, QXA. And then the state took both of those programs and combined them, and it's now called Quest Integration. And that was started January 1st of this year. And 5 health plans providing that coverage, that plan in Hawaii. And so to qualify for Medicaid, you go into the Quest Integration Program. And again, for long-term services and support, there is an asset test. But otherwise, it's an income test. And I have to disclose, I'm not an expert on it, and it's
complicated.
It's complicated, and the health plans don't determine eligibility for Medicaid. It's the state of Hawaii that DHS MedQuest.
So would they call them to see if they qualify, or can they call you?
And the state of Hawaii, they've really moved to improving the application process, and you can do that online.
Wow, that's great.
Yep.
So when you say dual eligible, that means they qualify for both. But what kind of plans do they actually get? Do they get 2 plans, or is it a blended plan, or is it added benefits?
It's really 2 plans. So, and on Medicaid, the dual eligible can go into one of the 5 health plans that are Quest Integration plans. For their Medicare coverage, they can stay on original Medicare. But they need a Part D pharmacy program, or they can join a Medicare Advantage program, a regular one, or they can choose what's called a Medicare Advantage Special Needs Plan that's designed specifically for dual eligibles. And we're one of the, United Healthcare is one of the plans here that offers a dual special needs plan. And
that is statewide. And do the plans change by different counties?
Most of the plans are statewide for both Medicare and Medicaid, and I believe one is just on 2 islands.
Okay, and so do they have a zero premium dual eligible as well, or is that a premium paid?
For the dual eligibles, there is on the Medicare side there is no premium for
Medicare.
Yeah, for Medicare. It's the design of the program, and and it works with it interfaces, if you will, with Medicaid. So dual eligibles, they have the choice of whether they want to be on a Medicare Advantage program or not, and they could actually have their Medicaid coverage with one health plan and their Medicare coverage with another health plan if they wanted to. I do see a value in dual eligibles having both their Medicaid and their Medicare coverage with the same health plan. It actually helps that health plan help them coordinate their benefits and their services. I mentioned our service coordinators.
Yeah, 100.
In the field there. Yeah. So when we have a dual eligible, they can help that senior coordinate their coverage with both. It's also helpful to providers from a administration standpoint because they're submitting claims and they're working with just one health plan as well. And when you look at what Medicare covers for dual eligible versus Medicaid, the Medicare side is going to be covering their acute care services like hospital and physician services, and then the Medicaid side is going to cover very often a lot of their post-acute care, like if they have to go into a nursing facility or they need supportive services in their own home.
Yeah. What do you think, since you've been in this field for a while, and especially the last 10 years with seniors, what do you think some of the future challenges are going to be for our kupuna? I mean, Oahu versus the neighbor islands. Because I know I've always tell people it's going to be a little more difficult on the neighbor islands, unfortunately.
Yeah. Well, I think the challenges for our seniors, across the state and maybe more so on the neighbor islands is actually the same challenges for, everybody, which is, we do have a healthcare workforce issue. We have a looming, if not already, shortage of physicians. We have a physician workforce that is aging.
Yeah.
My
eye doctor is going to retire, and he's not taking Medicare anymore.
Yeah.
My wife's doctor actually just stopped using insurance. She said, "Pay me $6,000 a year. You can see me as much as you want. No insurance." She only wants 200 patients.
Mm-hmm.
I mean, I hope it's not getting to that point, though.
Well, I hope not either. I think you hear stories about some places on the mainland where providers have just said, I'm not going to take Medicaid or Medicare anymore. I would like to think that the healthcare delivery system here has a little more aloha in terms of caring for people in our community.
Mm-hmm.
But nonetheless, when you look at the aging of Hawaii, and as you get older, you use services more frequently, and we've got to have a healthcare delivery system that can address that issue. So I think that's a challenge. A challenge for our seniors as well as for the entire population is Hawaii is an expensive place to live. And you look at the cost of housing, the cost of food. It's a problem, and you may retire, at age 65 or so, and think that you'll be okay for the rest of your life. And then the cost of housing, the cost of everything goes up, and you're in trouble. And as you well know, we've got a homeless challenge in Hawaii, and unfortunately, that includes seniors.
Yeah, I mean, I jokingly say, where if you want to be homeless, where else do you want to be? Hawaii it's not a bad deal. And, people have mentioned before about how some of the other states have given one-way tickets to Hawaii. And that's a whole nother story. But I think the issue is really going to be for homeless is going to be the seniors. And you had mentioned something earlier during the break that, there are some seniors out there that don't have any health insurance coverage. Is that correct? And they only go to emergencies.
Well, some of the, I don't know how many of the homeless elderly do not have health care coverage or not. That's actually another challenge too. Is
Sure.
that they may qualify, but trying to connect to them and get them through the eligibility process and onto health care coverage is sort of one challenge.
Mm-hmm.
The other challenge is even if they do have coverage. If they're homeless, or they're difficult to find, or they're moving from one temporary housing
Right.
situation to another. The challenge as a health plan and for the healthcare delivery system is trying to get them connected with the appropriate care provider. And whether that's a clinic, a community health center, or a medical group, or independent physician, so that their healthcare needs can be addressed, and so they have a plan again, versus just going to the emergency room.
Yeah, just winging it.
Yeah.
Yeah. Some of the challenges that we were talking about, what I wanted to talk about is we talked about underweight seniors, but I'm on the arthritis board here locally, and we just had our big event last month. But that is such a long-term debilitating disease, and it's lifelong once you obtain the arthritis problem, right?
Mm-hmm.
Yeah. And so what are some of the things that they can do, or have you seen what kind of challenges? How can they address these challenges?
So, in terms of arthritis pain, which is mentioned in the report there, again, it gets back to, are we helping our seniors get into, preventative care visits, getting in to see their physician, their providers, to address that earlier rather than later? Are they getting the right treatment, access to the right treatment? There was another comment in the report in terms of pain management. And it's kind of a double-edged sword with pain management, because on one hand, we do want our seniors to be, if they are in pain for debilitating situations, to improve their quality of life so they're not suffering. On the other hand, you've got to be careful with pain management, because we do have an issue on the other end of the spectrum in terms of abuse of pain management pharmaceuticals. But back to arthritis, it's again about getting in there, addressing the issue early on, and doing what you can do to slow the disease and to manage the disease, and try and help improve the quality of life as much as possible for our seniors.
I think also Alzheimer's and arthritis is one of the two major diseases that you really can't stop or really slow it down, but we can just stay healthy and eat better. In our June-July issue, we're going to have an article on the pharmaceutical problem in Hawaii. Edgy Lee did a documentary on the problem, not only in Hawaii but nationally. So we're going to put that in a magazine, our June-July issue. But you've been in this industry for a long time. What are some of the things that we can do as a community, as a magazine, as United Healthcare, to help our seniors live a little better? What would some of the suggestions you think we talked about?
Well, I think I appreciate the magazine a lot.
Thank you.
And I think it's very helpful. And part of that is because I think the more information that we can present the right way to the communities and to our seniors, so that they can learn and educate themselves, so that their caregivers, their family can, learn about, what kind of steps or what kind of things that they can do and be aware of, is extremely important. A lot of it is really just about awareness, awareness that there are there is healthcare coverage out there that's available, awareness of, one of the things about healthcare that I think is being looked at and addressed is healthcare is not just about healthcare. So it's not just about going to the physician and preventative care, going to the hospital when you need to. It's really broader than that, and it's what I would many people refer to as the social determinants of healthcare. And so when you look at seniors, it's not just about are they getting in for their flu shot, are they getting in for their regular checkups, but it's what's their housing situation, what's their food situation, what's what's their quality of life? I mean, do they have social interaction with other people? Are they doing the things that they enjoy? All of those things, and financial issues too. And all of those things really have an impact on their healthcare status.
Right. It's so important. We got a few more minutes here. Now, for a lot of people, they think the only time they can enroll in Medicare is during the Medicare enrollment period, which is October to first week of December or something like that, right? Around there. But a lot of people don't know as they age in and when they turn 65, they have to spend 2 or 3 months to research the plans, don't they?
Yes. Yeah. So, as you're, and I'm glad I'm on the radio so nobody can see me. I'm getting closer to that age of.
We all will get there.
We all will get there. But it's very important to look ahead at least 3-4 months before you qualify for Medicare and make sure you get the paperwork in process. In terms of choosing a Medicare, if you want a Medicare Advantage plan, Medicare program, if you're you really can choose that once a year. There are certain situations where you can change, back to original Medicare or switch plans, and that's when, as you said, when you age into Medicare. If you move from the mainland to Hawaii, you're moving from what CMS calls one service area to another.
I didn't know. I didn't think about that.
And you can change plans. Another example, if you move from the Big Island to Oahu, and you had one Medicare plan because your doctor in Hilo participated with that Medicare plan, and you come to Oahu and you find you're moving different service area, and you may find that the doctor or the health system that you want to participate in
it's a total different plan.
Could work with a different plan.
Wow.
So you could change plans then as well. We talked about the dual eligibles earlier that have both Medicare and Medicaid. They actually have the flexibility to select a Medicare plan all year round as well.
Really?
So they have actually more flexibility.
What are these snowbirds, as they call them? People that come and live in Hawaii during the summer. So what do? They must have their main doctor at their home state, right? Mm-hmm. But then would they not have services in Hawaii then?
No, it's so the snowbirds are the people who travel from one state to another quite a bit. An HMO or a Medicare Advantage plan might not make sense for them because they're going to another state with different network and so forth. So they may choose just to stay with original Medicare and have a Part D plan that many of the Part D plans like ours are across the country as well as in the U.S. territories. Or they may select like what's called a Medicare Gap policy. And Medicare Gap policy helps fill in the Medicare copays and coinsurances, and you can kind of take that wherever you go in the U.S.
Wow, it's interesting. Well, Dave, you got a few more minutes. Any last comments about United Healthcare and our seniors in Hawaii?
It's been a real pleasure to be here and talk with you. It's obviously near and dear to my heart. I live and breathe healthcare and really focused on Medicare and Medicaid. I hope the report is useful for the state of Hawaii.
Yeah, we're going to put something in the magazine, I believe, the next issue.
Yeah.
Because I love the report. I was kind of surprised we weren't higher, but that's okay. That gives us a goal to get more exercise in there. But you guys have been a leader in the country, let alone Hawaii, so I thank you very much here in Hawaii. And I know you guys support a lot of senior groups, so thank you very much. They want to mention you guys have to like our Facebook page. The Generations Magazine has a Facebook page and a LinkedIn, by the way, but also our Twitter account. So yeah, I don't know. You got to like our page, so please like us. We're here every Saturday from 5 to 6, Sunday from 3 to 4 here on AM 690 The Answer. Dave Heywood from United Healthcare here in Hawaii. Thank you so much, and we'll talk to you guys soon. So have a great weekend. Aloha, and live well.